I am Dr. Munmun Ghosh, Assistant Professor of Bashundhara Ad-din Medical College. Today I discuss item 3 in topics of renal physiology. Kidney. Kidney is a retroperitoneal organ and they are situated in the posterior wall of the abdomen. And it is retroperitoneal organ means its anterior wall is covered by peritoneum and posterior wall is devoid of peritoneum. In the human body there is 2 kidney is present and main function of the kidney is formation and excretion of urine. This figure show the kidney and anatomically in the cross section kidney has outer cortex and inner medulla, and medulla is composed of pyramid and apex of the renal pyramid is called the papilla, and papilla opens into the minor calyx, and minor calyx ultimately 2 and 3 minor calyx join and to form major calyx, and 2 and 3 major calyx join together and to form pelvis, and ureter is the continuation of the renal pelvis. And in the papilla of the renal pyramid collecting duct is open. So, urine there is a structural and functional unit of the kidney is nephron. In our body 1 to 1.5 million nephron is present in each kidney, and nephron cannot be regenerated, and parts of the nephron is renal corpuscle and renal tubule. Renal corpuscle is composed of Bowman's capsule and glomerulus, and renal tubule is composed of proximal convoluted tubule, descending limb of loop of Henle, ascending limb of loop of Henle, distal convoluted tubule, collecting tubule and collecting duct. This is the parts of the nephron, and there are 2 types of nephron present in the kidney. One is cortical nephron, another is juxtamedullary nephron. Cortical nephron. Cortical nephron, amount of cortical nephron is 80 to 85% and juxtamedullary nephron is 10 to 15%. Cortical nephron is situated in the outer cortex and juxtamedullary nephron situated in the inner cortex near the medulla. Juxta means near, juxtamedullary nephron means near the medulla. So, the situation of juxtamedullary nephron is inner cortex near the medulla. In case of cortical nephron, loop of Henle is short and juxtamedullary nephron loop of Henle is long, and blood supply of the cortical nephron is peitubular capillary and blood supply of the juxtamedullary nephron is vasa recta. And function of the cortical nephron is formation of diluted urine, and function of the juxtamedullary nephron is formation of concentrated urine. এখন another question arise from this difference between the cortical nephron and juxtamedullary nephron. What is vasa recta? Then I tell that vasa recta is a specialized branch of the peitubular capillary, and function of the vasa recta is formation of concentrated urine. Now I discuss the renal blood supply. Renal blood supply is renal artery, and then renal artery, interlobar artery, arcuate artery, interlobular artery, afferent arteriole, glomerular capillary, efferent arteriole, peitubular capillary, interlobular vein, arcuate vein, interlobar vein, renal vein. This is the blood supply of the renal blood supply. In the renal blood supply, it is almost part of the anatomy, but in physiology there is it is the unique organ of the body. Kidney is the only unique organ of the body. It has 2 set of capillary, that is glomerular capillary and peitubular capillary, and glomerular capillary and peitubular capillary is connected by efferent arteriole. Then another topics is in glomerular capillary, hydrostatic glomerular capillary, filtration occur in the glomerular capillary, and peitubular capillary reabsorption occur. One most common question arises that why filtration occur in the glomerular capillary, because high hydrostatic pressure. Glomerular capillary hydrostatic pressure is high, that is about 60 millimeter of mercury. For this region, glomerular capillary filtration occur. In the peritubular capillary, reabsorption occur. Why reabsorption occur in the peritubular capillary? Due to low hydrostatic pressure. Then another question arises that why hydrostatic pressure is more in the glomerular capillary. Then say that in the general in our body, in one capillary it has two ends, one arterial end and venous end, but in case of glomerular capillary its both end is arterial end, that is afferent arteriole, glomerulus and efferent arteriole. Number one point is high hydrostatic pressure in the glomerular capillary due to its both end is arterial end. Then second point is physiologically efferent arteriole lumen is constricted. So, the blood comes from the afferent arteriole, same amount of blood does not come from the efferent arteriole. So, backflow into the glomerulus, for this region glomerular capillary hydrostatic pressure is more. The blood flow to the kidney is, total blood flow to the kidney in two kidneys is 25% of the total cardiac output. So, our normal cardiac output is 5 liter per minute. So, 25% of cardiac output means 1200 to 1300 ml per minute. So, one most common question is what is renal blood flow, what is renal fraction and what is renal plasma flow. Renal blood flow means total amount of blood passes through both kidney per minute is called renal blood flow, means 1200 ml per minute. Renal plasma flow, we know that 55% in the blood, 55% is plasma and 45% is cell. So, renal blood flow is 1200. So, 55% of the 1200 is 650. So, this is the renal plasma flow. So, now I tell the definition of renal plasma flow. Total amount of plasma that passing through both kidney per minute is called renal plasma flow. That means 55% of the total renal blood flow. Amount is 650 ml per minute. And what is renal fraction? Renal fraction means percentage of cardiac output that is supplied to both kidney per minute, that is about 25%. Previously I told in blood flow is to the kidney in two kidneys 25% of total cardiac output. This 25% is called renal fraction, and renal blood flow to 25% of the cardiac output means 1200 to 1300 ml per minute. This amount is renal blood flow, and renal plasma flow 55% of the 1200 is renal plasma flow. Now I tell the function of the kidney. Previously I also told one of the most important function of the kidney, formation and excretion of the urine. Though this formation of urine, it has also served many homeostatic function. Homeostatic function, that is regulation of water electrolyte balance, regulation of acid base balance, regulation of body fluid osmolarity, regulation of blood pressure. It also secretion and metabolism of some hormone, that is renin, erythropoietin 125 dihydroxycholecalciferol, and it also performs some metabolic function, that is gluconeogenesis during prolonged starvation. Now I tell the juxtaglomerular apparatus. Three types of cell combine to form juxtaglomerular apparatus, that is macula densa juxtaglomerular cell and Lassie cell or extraglomerular mesangial cell. Now I tell what is macula densa. Macula densa, it is the specialized group of cell in the distal tubule is called macula densa. And what is juxtaglomerular cell? Juxtaglomerular cell is smooth muscle cells of the afferent arteriole and efferent arteriole that are swollen to form juxtaglomerular cell. And what is Lassie cell? Lassie cell are situated in between the macula densa and juxtaglomerular cell. And these three type of cell combine to form juxtaglomerular apparatus. And function of the juxtaglomerular apparatus, they are helps in autoregulation of the renal blood flow and production of renin. Renin is produced by juxtaglomerular cell, and autoregulation of the blood flow is maintained by the mainly macula densa. It sends the, if sodium chloride, amount of sodium chloride is less in the distal tubule, then it sends the sodium chloride amount is less, and he sends sensation to the juxtaglomerular cell to secrete renin, and renin convert angiotensin-O into the angiotensin 1, then angiotensin 1 is converted to the angiotensin 2, and this angiotensin 2 ultimately acts on the kidney to secrete aldosterone, and aldosterone helps in sodium water reabsorption, and it also causes efferent angiotensin 2 also causes efferent arteriolar constriction. For this region efferent arteriolar constriction occur, so juxtaglomerular capillary hydrostatic pressure is increased, and for this region GFR is increased and GFR is increased and sodium chloride amount is increased in the distal tubule. By this process it maintains the autoregulation of the renal blood flow. Next I discuss the glomerular capillary membrane and peculiarities of the renal circulation. Thanks.